When Freud talks about the pleasure principle, the pleasure principle is about experiencing pleasure, but what's the other part of pleasure? Avoiding pain. Pain is also mediated through what's known as the salience network, the mesolimbic pathway. Pain and pleasure, two parts of the same coin. I've covered this and how to modulate this in a lot more detail in part 3 of the chronic fatigue fibromyalgia. In fibromyalgia, we go through this in a lot more detail. So we psychiatrists can do so much in pain medicine by addressing frontostriatal-limbic circuits. So bear that in mind. When pain here describes a bloating as severe and constant, she notes that pain can be so intense that it disrupts my daily activities. Engel talked about pain as biopsychosocial. Pain is a perception as well. And this salience, when we talk about salience, what does it mean? It means a stimulus that has taken over us. So yes, there may be a physical aspect present to it, an injury, etc. But because it's mediated through the salience network, it becomes a perception gradually that becomes all-consuming. If you've ever had patients with tinnitus, repeated tinnitus, despite investigations, think about salience, right? So we'll talk about these parts because it's so relevant. What's the treatment? Addressing the salience network. Cover that. You see, there's a thought hierarchy as well, and this is linked to perception. This is the salience network. You see, whenever we have arousal initially, there is preoccupation, right? Preoccupations are in anxiety disorders. It's described as a worry about stimuli. This could be, if it's social anxiety, it's social situations, fear of scrutiny, embarrassment. If it's generalized anxiety, it's, say maybe relationships, common things in life, relationships, finances, etc. There is, a panic disorder, for example, which involves fear of having panic attacks, along with sometimes agoraphobia is present, sometimes not. So anxiety about certain stimuli. It involves preoccupations with avoidance and arousal symptoms, right? Autonomic arousal symptoms. The key question here is to ask them if they can control it. What I ask them, are there times when you experience relief from these symptoms? And patients with anxiety will tell you, I prefer going to work because I don't think about all the worries I have at home. Or I prefer coming home and stay away from work. It's the avoidance. Why do they have avoidance? It's a perfect example telling you that the prefrontal cortex can control the arousal at key times when the stimulus is not there. Remember this key bit because it's part of the salience. When I say salience, I mean salient stimuli are stimuli that grab our brain's attention, right? And as human beings, we cannot function with one stimulus consuming us. We have to have a range of stimuli. So if we have pain consuming us, salience networks involved. Tinnitus, addiction, alcohol consuming us, salience network as well, right? So when there is avoidance, avoidance provides relief. That's telling you top-down inhibition when the stimulus is reduced. When the stimulus is taken away, they can have relief. That's why they avoid it. Next level up is obsessions. Obsessions are intrusive, ego, dystonic, described as senseless. Can they relieve their anxiety? Can they relieve their distress? In other words, can prefrontal cortex reduce arousal? Yes. How do they do it? Through behavior, compulsions. The key here is to remember that they can obtain relief. They figured out a way to do that. And you can see treatments for both of these include serotonergic potentiation. Of course, later on, clomipramine, etc. comes in. But here's what happens. As the control is lost, why does the control get lost? Prefrontal cortex weakens in some individuals. That's when you move to the next level, right? That's when you move to the next level, which is ruminations and overvalued ideation. This is where the definition is all-consuming. You ask them, what proportion of the day do you spend thinking about it? They find it difficult to control all the time. I cannot get it out of my mind. It's there with me at all times until I go to sleep. That's patients were telling me, you know, in so many different ways. A recent 99% of the time. This is mediated predominantly by salience. This one can worsen with antidepressants.